So my name's Rihanna. I work on behalf of Ramsgate PCN, which is all 5 surgeries in Ramsgate.
I'm Claire, I'm a senior mental health practitioner in primary care and I work in Canterbury.
I started in 2016, I finished my qualification in 2019. I then started on the ward for during the COVID period, and I did that for about a year and a half. And then I decided to go into a developmental band 5 role in A&E Liaison, and I did that for 2.5 years. And then after that, I ended up here.
I started off my career as a mental health nurse, and then after that I did additional training. So I did 2 masters. I'm on my second one now, which is the Advanced Clinical Practitioner, which is nearly finished.
So when we were in A&E Liaison, we noticed that there was the similar pathway. So in terms of assessment and then referral, we also noticed that a lot of people maybe in primary care that weren't getting either seen as quickly as what they should have been, or there was missed gaps in kind of care or support that maybe they could have had, which could have prevented secondary care referrals.
The reason why I joined primary care was purely because I really enjoyed that preventative work. I think it's really nice that we can prevent problems from needing secondary services, and we feel that we're actually saving the GPs lots of time. We're able to give the patient that extra time as well, and they feel a lot more valued, which is a really nice aspect of it.
I specifically will assess initially, and then I'll go with a follow-up plan if needed. I potentially would triage a patient to see kind of what the initial issues are and whether I could do something immediately before they have their assessment, depending on kind of how long my waiting list is, because it can be a little while depending on kind of how many referrals I've had at the time. So during my triage process, I'll look at immediate risk and look at whether I need to actually send somebody some support numbers out. I'll look at other types of risks, maybe whether they're immediately in danger, whether actually primary care is suitable. So that will be part of the triage process. During the full assessment, I'll book someone in for an appointment for when my next slot is, which will be a double slot, so that they've got plenty of time to talk about kind of what's going on, what they've been going through, whether there's other things that I can help with, or other services that I can refer to. And then after that, if they need a period of support, I'd give up to 3 sessions and then refer them on.
So my day-to-day role entails, makes it quite easy for the GP, so the GP just books into my diary, and then so that obviously saves a lot of time with that referral process. We'll generally assess the patient and signpost to services that are required, or we would do a chunk of work with that patient depending on the need. Some patients need a lot more than a few sessions, and sometimes we'll keep them on, but it's dependent on the need, because there is a gap and it's preventing that patient from falling through the gap, and that can prevent them from going into secondary services, which is what our aim is.
So first and foremost, with the practices, all 5 that I work with, we've noticed quite a difference in terms of maybe a GP might assess and they would just automatically send to secondary services. So there's also bits of healthcare, and there's the other IAP services and things like that, and a lot of people might not necessarily actually refer to them themselves. They often get sort of sent self-referrals, and you speak to them several months later, for example in A&E, and they've never actually made that referral themselves. So often we will make the referral on their behalf, so it's much more likely they're going to get the care in place before they come to a breakdown situation.
Part of my job role, I do quarterly figures, and we looked at the figures over the past 3 months from October to December, and we found that we saved GPs 3,107 appointments in that short period of time. And obviously you have bank holidays, etc. in there, so it'll probably be a lot more. So that's just over a quarter. So in the future, that's probably going to save the GP a lot of time. Also, patients have given feedback, and they feel very listened to. They feel quite supported, and also they feel that they've had feedback and support in a quick response time. Generally we can get to people within 2 weeks at max, and we're only going to get bigger, which is really exciting.
Very well supported. I'm really lucky. All 5 surgeries are absolutely brilliant. They're as mentors, as colleagues, whatever my issue, whether it be sort of a personal or a professional issue, they're really good, very supportive, and if they don't know, they will refer you to someone who does know. So, and then above kind of that within my own trust there, I also have lots of support from that aspect as well. So kind of band 7s, or my lead manager, there are lots of people there for support if I need it.
And yeah, I feel very well supported. I have an increased respect for primary care. They work incredibly hard, and everyone in Canterbury is just very, very supportive. They will always respond to you, whether that be about patient feedback or if you've got complex cases. Very, very well supported. We have clinical supervision, which is really helpful. And they're always open to training and giving additional support. They're always fighting for patient care and making sure that's number one, and it's definitely you can definitely see that in their work ethic.
So for me personally, so completely new to primary care, always been in secondary care and kind of used to their ways of working, and specifically always worked with the same trust as well. So yeah, kind of processes from that aspect, knew them sort of fairly inside out. So coming into a new team, new program of working, new ways of working completely, so it's quite helpful to know everybody's different perspective, how they work, whether there's certain aspects of what they do that's more helpful than what we're already doing. So it's just about learning, really. I suppose because we've just been through COVID and everything has been virtual, for me personally, being able to see people face to face and engage with people, that's kind of a bit of a breath of fresh air, really. So from that aspect, it's been great. And in terms of like the venues that they use, the professionals that are involved, everybody's been really, really good.
So I found it really beneficial because there was so much involved in the programme. Also, it's really good for networking. That was really good. It was really nice to see everyone that was new that was coming into primary care. So that was quite nice, wasn't it? Like you said, not having that virtual experience and having face to face was really nice, and the venue was lovely too. So yeah, it was good.
My kind of running thing at the moment is applying for my masters. So I need to sort of go into sort of further education to look at sort of increased banding and things like that, leadership and all of that sort of thing. So that's something I have to do. It's a bit of a challenge for me because I also have other needs, so for me it's kind of a bit of a barrier, but I will get there. It's just looking at the right program for me, which is, I suppose, in terms of the new to practice program, is quite helpful for that respect as well, because you have coaching sessions and mentor sessions, so they can kind of help guide you in the right direction when you're sort of feeling a little bit stuck.
So I'm actually doing my advanced clinical practitioner, and I should be finished in March, so fingers crossed. So yeah, so that's the trajectory I'm going. It's obviously more clinical specialised.